examples of where we have extensive price controls. Look to Venezuela, look to the Soviet Union. The old story in the Soviet Union was a guy goes into the store and he says, are you the store that doesn't have eggs? And the guy says, no, that's across the street. We're the store that doesn't have toilet paper. Because they were so used to having shortages of things. You want people to have stuff. You want people to have the basics of life. You want them to have food. So, do we have a right to food and health care? As the ranking member would say, well, you can say that, and then you can set prices, but it doesn't work. What happens in capitalism is you have a freely fluctuating price. Now, are pharmaceuticals freely fluctuating prices? No, most of it's interrupted by an intermediary. The government, in over half of the cases, is the intermediary, and then insurance companies are the intermediaries and others obstructing the real true price. The only real true price of drugs in our country applies to about 3 or 4% of people that have absolutely no insurance. Not something I'm recommending, but they're the only people who really care. Almost all the prices are already set throughout the system. So while I think this is well-intentioned, I think the history of price controls is not a good one, and I will oppose it.
Senator Baldwin.
Amendments?
No. Does anybody else wish to speak on the bill? Okay. Do any members wish to offer an amendment?
Mr. Chairman.
Senator Baldwin.
I want to start by expressing how excited I am to have the Insulin Act on this markup today. This bill will make insulin more accessible for millions of Americans and significantly reduce the cost of insulin. No one should have to go without the medication they need to stay healthy. And that's why I introduced my amendment, Baldwin-Collins number 1. This bipartisan amendment would restore a pilot program for uninsured patients to access insulin for $35 a month and a resource center to help patients afford and access affordable insulin. Both of these policies were in the original text of the Insulin Act, but unfortunately are not in the manager's amendment before us today. So I ask for the support of all of my colleagues on this amendment to ensure that patients without insurance are not left behind and that patients have access to resources to help them find information about access to insulin. And Mr. Chairman, I ask for a vote on my amendment, Baldwin 1 to S4189.
Okay. I commend Senators Collins and Shaheen for their tireless work advocating on those who need insulin to survive. And partly, perhaps largely because of their efforts, most commercial insurance companies now voluntarily cover insulin for only $35 out of pocket. While I support the core policy of the Insulin Act, I cannot support creating new duplicative grant programs that exacerbate the problems in our healthcare system that drive healthcare cost. Community health centers already provide deeply discounted insulin to patients, regardless of insurance status or ability to pay. Community health centers and many others receive billions in both mandatory and discretionary funding to support their mission by participating in the 340B program. Any 340B provider is getting insulin for pennies on the dollar. These savings are supposed to be passed on to the uninsured or low-income patients to pay for insulin and other treatments on a sliding fee scale. There are real transparency and oversight concerns that prevent 340B from translating to better access and lower costs for patients. So rather than holding covered entities accountable to ensure that existing resources are being used as Congress intended, this amendment creates another source of funding and enables further diversion of 340B revenue away from that which Congress originally intended. I will note that the Trump administration strongly opposes this provision. I acknowledge that members on both sides of the aisle may support the amendment, and I share the goal, having practiced medicine in a hospital for the uninsured and the uninsured, to have affordable insulin. But I'll say the hospital where I practiced used 340B the way it was supposed to be used and actually gave the medicine for free to those who came in. And I would say that this amendment is giving cover for 340B entities which is not using the program the way that we intended it to. They're using it as a money grab. Now, I urge my colleagues to oppose this amendment, and allow others to speak or make my motion?
Could I, Mr. Chairman?
Senator Sanders.
Thank you. Mr. Chairman, I strongly support capping the out-of-pocket cost for insulin at $35 for Americans. The underlying legislation, as we know, does that for Americans who have insurance, but it does not do that for the uninsured, and that is what this amendment addresses. As I think we all know, several years ago, as part of the Inflation Reduction Act, we were able to make sure that people on Medicare do not pay more than $35. We also had success in substantially lowering the cost of asthma and OCD inhalers. Bottom line, we are having success in making insulin available to those who need it. This is an important amendment. Let's support it.
Mr. Chairman.
Senator Collins.
Mr. Chairman, I support this amendment and am pleased to be the principal co-sponsor. The original bill that we reintroduced in this Congress had this provision in it. In an attempt to move the bill along, we agreed to take it out and decide it at the committee level. But I think it's important that we not leave this population, the most vulnerable population, behind. Thank you.
Does anyone else wish to speak? I now make a motion to table the amendment. I shall be voting to table. The clerk should call the roll.
Senator Paul?
Aye.
Senator Collins?
No.
Senator Murkowski? Senator Marshall? Senator Scott? Senator Hawley? Senator Tuberville? Senator Banks? Senator Heasted? Senator Moody? Senator Armstrong? Senator Sanders?
No.
Senator Murray?
No by proxy.
Senator Baldwin? Senator Murphy?
No by proxy.
Senator Kane?
No by proxy.
Senator Hassan? Senator Hickenlooper? Senator Markey?
No by proxy.
Senator Kim?
No by proxy.
Senator Blunt Rochester? Senator Alsobrooks?
No by proxy.
Chairman Cassidy?
Chairman Cassidy is a yes and notes that Senator Scott is yes by proxy.
And Moody is a yes. I thought we were voting on the amendment. I apologize.
On the amendment?
Yes.
I thought we were voting on something else, so I'll change my vote. I apologize.
And so you change it to
Yes.
a yes. And Armstrong is a yes by proxy. And Murkowski is not voting.
Okay. I have 10 ayes, 12 nays.
The motion is not agreed to? Is not tabled?
It is tabled.
The motion is not tabled, correct?
Not tabled.
No.
It's not tabled. Yeah.
I now